Hi, everyone, and welcome to the first in our series on big data at the margins, digital care and cruelty, social provisioning and deprivation in the era of big data. My name's Alyssa Hearn, and I'm a member of the Big Data at the Margins Organizing Committee here in the Faculty of Information and Media Studies at Western University in London, Ontario, Canada. I want to begin our event tonight by acknowledging that while we are all gathering remotely, most of us are situated on the traditional territory of First Nations and Indigenous peoples. I acknowledge that I'm joining from the territory of the Wendat, the Anishinaabe, the Haudenosaunee, the Métis, and the Mississaugas of the Credit First Nation. I encourage you to recognize and respect the traditional holders of the land on which you're located today. These lands continue to be home to diverse Indigenous peoples whom we recognize as contemporary stewards of the land and vital contributors to our society. So, Big Data at the Margins is a 5-part series of panels and workshops that will take place throughout 2021. And it's dedicated to exploring the impacts and pitfalls and opportunities afforded by the use of AI, big data, and machine learning on groups who are economically, socially, and geographically on the margins, who might live in smaller towns or cities or rural areas, and might be economically and socially marginalized even within those small communities. We drew our inspiration from the immediate context of London, Ontario, home to Western, which is itself a small city on the margins of 2 giant cities, Toronto and Detroit. And our goal was to focus on the ways that various aspects of everyday life for folks in these places, access to social resources, housing, health, employment, environment, policing, legal and Indigenous rights are being challenged and transformed by the introduction of these proprietary automated machine learning and big data systems. So please watch for the second event in our series that's coming up, Digital Policing, Facial Recognition Software and Community Resistance, with Tawana Petty, Anne Kavukian, and Deborah Raji. And that's going to take place February 25th and 26th. You can find links to register on our new website that we just got up, and that'll be put in the chat as well. The address will be posted in the chat. And there's also a few spaces left for our up close and personal 2-hour workshop with our speakers tomorrow morning, starting at 11 a.m. Eastern Standard Time. So if you're interested, please look for an email address in the chat to sign up for that as well, if you're interested in the workshop. I want to thank our very generous sponsors, the Social Sciences and Humanities Research Council of Canada, Western Research, and Dean Lisa Henderson, and all the great staff and students and faculty at the Faculty of Information and Media Studies at Western. I also want to thank my other members of our organizing committee, Tom Streeter, Nick Dyer-Witherford, Luke Stark, Alyssa Santovani, and Joanna Redden. And I really want to thank our fearless event planner, Josh Lambier, and our intrepid researcher and scholarly rapporteur, Charlotte Panaton. And of course, I want to thank our wonderful speakers for being here with us tonight to launch our series. It's terrific to have them here. So now I want to introduce you to the moderator of tonight's proceedings, Alyssa Santovani. Alyssa is an assistant professor here in the Faculty of Information and Media Studies, where she researches the coevolution of technology, intellectual property law, and social practice. Her current projects focus on right to repair movements and technology use in K-12 education. Alyssa's research has been published in a wide variety of law, information science, and computer science journals. And prior to joining us at Western, Alyssa was a Microsoft Research Fellow at the Berkeley Center for Law and Technology at the University of California, Berkeley Law School, and a Research Fellow at the Center for Innovation, Law and Policy at the University of Toronto Law School. So again, thanks everyone for coming, and over to you, Alyssa.
Thank you, Allison. Hello and welcome, everyone. I am so pleased to host this first event in our Big Data at the Margins series. So I was reflecting on our theme this evening as I was walking here. As Allison mentioned, London is kind of a fairly average mid-sized Canadian city. It's so average, in fact, that London is frequently used as a test market for companies who want to try out their new products on customers. But we do have some special things going on here as well. One of the things that I particularly appreciate is a greenway that sort of hugs a river that transverses the entire city. The river is cleverly named the Thames. And particularly because of COVID and the frequent lockdowns, I, like many others, have sort of taken to spending more time outside, going for long walks along this river. Today, for example, I walked maybe an hour and a half. It was cold out. It was about -9 degrees Celsius, or about 16 degrees for my American friends. But we're in lockdown now, so I walk a lot. Maybe this is starting to sound a little bit familiar to some of you. On my walk, I saw all the things that you might expect. I saw snow, leafless trees, ducks and geese paddling in the river, people out for a jog, families strolling. And I also saw a few things that maybe you wouldn't expect. So I saw a massive shoal of gizzard shard, which is a type of fish, that was huddling in a tributary that's being warmed by storm drain runoff. And I also saw tents dotted along the riverbank, encampments. In London, in addition to shelters and temporary housing compounds, some of our homeless population seeks refuge on the riverbank in tents. So right now, the entire province of Ontario is under a stay-at-home order. There are some exceptions, of course, for what are considered essential activities, but what about these people who are living in these encampments along the river's edge that many of us regularly pass by? The provincial government's stay-at-home order excluded the homeless for semantic reasons, perhaps. But surely we can and we must do better. And London is trying, in part through big data initiatives. So big data has become somewhat of a catch-all term for things involving large-scale, computationally intensive information processing. In the context of our discussion this evening, we can think of big data as a set of tools, including machine learning algorithms and artificial intelligence, that governments and organizations can use to make better, more efficient observations, predictions, and ultimately decisions about what is and what should be happening in the world. In many cases, and social provisioning is no exception, the data that gets collected and shared among agencies is quite granular and personal in nature. Collecting and sharing data in this way, it is suggested, has the potential to increase efficiencies with respect to resource allocation and interventions. It can reduce information fragmentation, allowing those who have access to the information to create more detailed and holistic pictures of a person, a family, a neighborhood, a city. The hope being that we can eventually move beyond providing support and services to individuals and work toward addressing and remedying the underlying systemic causes for poverty, homelessness, food insecurity, lack of meaningful access to healthcare, and so on. Moreover, some proponents of these approaches argue that big data reflects a kind of objective detachment and reduces the potential for bias by removing or shrinking the role of flawed human decision makers. So with promise, however, comes peril. So the claims about bias, for example, are not borne out by the evidence. Rather than guarding against it, pernicious and persistent forms of discrimination seem entrenched in the design of many of these tools. In addition, critics raise red flags around privacy, data security, autonomy, bodily and identity integrity, human dignity, informed consent, accountability, and on and on. At a foundational level, the extent to which systems for social provisioning draw probabilistic inferences about a person that may or may not be accurate, and then use algorithmic mechanisms that, for the most part, are inscrutable black boxes to make decisions based on those inferences, decisions that affect the livelihoods of the people who are impacted, while at the same time limiting the moderating effects of human expertise. This is deeply troubling. So how should we make sense of what's going on here? How can we design and use technologies to promote well-being, particularly of those who are at the margins, who right now are in a tent on the riverbank? What does a humane digital future look like, and how do we get there? This evening, we are joined by 3 experts who will reflect on some of these challenges, and I hope shine a light on some paths forward. In addition to being internationally esteemed scholars, the panelists are also activists and will address the possibilities for collective education and action to challenge these tools' more pernicious effects. Before I introduce our panelists, I'd like to take a moment to give a little bit of an overview of how the session will work. So each of our panelists will have 20 minutes to speak. The remainder of our time will be reserved for Q&A. So I strongly encourage members of the audience to pose questions, and you can do so by clicking on the Q&A button at the bottom center of your screen and submitting your question there. You can ask a question at any point during the session, either before or during the Q&A. I'll do my best to ensure that we get through as many of your questions as possible, time permitting, after all of our speakers have had a chance to have their turn. In addition, you'll notice that there's a chat option. Many of you, it looks like, have already been using it to say hello, which is great. And you can use that as well for some back channel communication if you wish. But if you do have questions for the panelists, make sure they go into the Q&A slot, because that's the thing that I'm going to be checking and monitoring. And with that, I would like to introduce our first speaker this evening, who is Virginia Eubanks. Virginia is an associate professor of political science at the University of Albany, SUNY. She's the author of Automating Inequality: How High-Tech Tools Profile, Police, and Punish the Poor, and Digital Dead End: Fighting for Social Justice in the Information Age. She's also co-editor with Althea Jones of Ain't Gonna Let Nobody Turn Me Around: 40 Years of Movement Building with Barbara Smith. Her writing about technology and social justice has appeared in Scientific American, The Nation, Harper's, and Wired. For 2 decades, Eubanks has worked in community technology and economic justice movements. She was a founding member of the Our Data Bodies Project and a 2016-2017 fellow at New America. She lives in Troy, New York. So welcome, Virginia.
Thank you so much. I'm really excited to be here with everyone this evening. I'm Virginia Eubanks. I'm speaking to you from the unceded land of the Mohawk and the Abenaki. And I just want to start by expressing my deep appreciation for everyone at the University of Western Ontario, especially Alison Hearn for that invitation, and Josh Lambier for doing the hard and often sort of invisible work of herding the digital cats. And Alyssa, of course, thank you so much. Special gratitude for moderating tonight. Thanks also to all of you out there in the electron field. Thanks so much for choosing to spend some of what I find is very limited video conferencing bandwidth. So spending that time to engage in this crucial topic with us is really meaningful. And I appreciate you spending your evening or your morning or your afternoon, depending on where you are, to spend a little time thinking about the kinds of really important issues that are raised about around automated decision making in a time of pandemic and political strife and great uncertainty. So your organizers have asked that I give you a sort of brief introduction to my work and then perhaps reflect a little bit on what I've learned in the years since this book, Automating Inequality, was released. I find conversations about technology and ethics or about digital promise and harm can become needlessly and even harmfully abstract pretty quickly. So what I'd like to do is actually tell the stories of some of the people I interviewed during my reporting for that book, and then move on to say a bit about what I've been thinking about since 2018 when it came out, and some ways forward. So I want to start with the story of Sophie and Kim Stipes, because I think it illustrates how new automated decision-making in public services or social insurance, depending on where you are, how these tools have a tendency to automate austerity. So I dedicate automating inequality to a severely disabled little girl named Sophie Stipes. And when Sophie was 6, she received a letter that explained that she'd be losing her Medicaid, which in the United States is health insurance for the poor and working families. And this happened just as she was gaining weight, thanks to a life-saving feeding tube and learning to walk for the first time. So the Stipes family was caught up in an attempt to automate the eligibility processes for all of the welfare programs in the state of Indiana. In 2006, then Governor Mitch Daniels signed a $1.3 billion contract, that's billion with a B, with a consortium of high-tech companies that included IBM and affiliated computer systems. And the intention was to create a system that replaced the hands-on work of local welfare caseworkers with online applications and private regional call centers. The result was 1 million benefits denials in the first 3 years of the experiment, more than a 50% increase in denials from the 3 years before the experiment. And most of these denials were for this catch-all reason called failure to cooperate, which just meant that someone somewhere in the process had made a mistake. So it could be the applicant who could have forgotten a signature or missed one line in 34 or 45 or 50 pages of application. A call center worker could have made a mistake in applying policy. The computer system itself could have made an error. It could have not recognized a paycheck, for example, as proof of income because it was only programmed to recognize pay stubs. But failure to cooperate notices only said there was an error. They didn't say what the error was. And because the system severed the relationship between applicants and local caseworkers, the system virtually guaranteed that the burden of finding and fixing those mistakes fell squarely and solely on the shoulders of those people requesting services, who were some of the state's absolutely most vulnerable people. And this created enormous hardship for poor and working families across the state. And Kim Stipes, Sophie's mother, told me, during that time, my mind was so muddled because it was so stressful. All my focus was getting Sophie back on that Medicaid. And then I was crying afterwards because everyone was calling us white trash, moochers. It was like being sucked up into this vacuum of nothingness. So the second family I want to introduce you to is Angel Shepard and Patrick Grieb. And their story really illustrates how new automated decision-making systems can create feedback loops of injustice. So I met Patrick and Angel in Allegheny County, Pennsylvania. It's the county where Pittsburgh is. They were incredibly engaged, creative parents who nevertheless had been red flagged several times for child neglect by the county's Office of Children, Youth, and Family Services. So Patrick and Angel's primary crime was that they're poor. Patrick was found guilty of child neglect, for example, when he couldn't afford an antibiotic prescription for his daughter after an emergency room visit. So they live in a kind of constant low-grade terror that this new statistical model the county is using, it's called the Allegheny Family Screening Tool, will target their daughter or their granddaughter for a child welfare investigation and potentially for removal to foster care. So this model's built on top of a data warehouse that, as of the writing of the book, held 1 billion records, more than 800 records for every single resident of Allegheny County. Data extracts were regularly collected from different agencies like adult and juvenile probation, the jails and prisons, county mental health services, the state office of income maintenance, the public schools, and other agencies that primarily serve poor and working families in Allegheny County. So the limits of that data set really shape what the model is able to predict, because it relies almost entirely on information that is only collected on families who reach out for help to public assistance or social insurance programs. It means that the model is only able to see potential harm in those families. So professional middle-class families likely require and request equal amounts of support, because I've never met anyone who can raise a family on their own. But because they pay for it through private employer-provided insurance or out of pocket with cash, their data doesn't end up in these public data warehouses. So that data doesn't end up in these predictive models that try to guess which families will be risky families, which parents will be a danger to their children. And this leads to what the parents I spoke to in Allegheny County called confusing parenting while poor with poor parenting. And what's interesting, as Alyssa sort of mentioned at the top of her introduction, is that the model's designers and the Children, Youth, and Family Services administrators in Allegheny County say that part of the purpose of the system is to root out bias in intake call screener decision-making. So intake call screeners are these people who pick up the hotline for abuse and neglect claims or receive reports from mandated reporters and decide which cases to refer to a full child welfare investigation. But these models don't actually remove bias. They simply move it from one place to another. So in Allegheny County, the model moves discretion from the frontline caseworkers, who are, by the way, the most working class, the most female, and the most diverse part of the Child, Youth, and Family Services workforce. And it moves it instead to the economists and data scientists who build the models. So the issue here is not discretion, yes or no, it's discretion to whom. Who gets to have discretion in these new systems? And part of the problem is that the system's designers, those economists and data scientists, only address bias as a property of individuals, as faulty logic, as implicitly or explicitly discriminatory beliefs about families based on race, class, or other factors. But of course, inequity is systemic and structural. And in fact, the county's own research shows that the great majority of racial disproportionality in that system comes not from intake screeners, but from the community itself, which reports Black and biracial families for maltreatment 2.5 times more often than they report white families. By limiting intake workers' discretion then, the system may actually end up limiting their ability to correct for this overreporting and may, in the end, worsen inequality. So this sort of combination of human and digital surveillance in the Office of Children, Youth, and Family Services in Allegheny County leaves families like Patrick Angel and their daughter Harriet feeling ambushed and helpless. So Angel said to me, "You feel like a prisoner. You feel trapped. It's like no matter what you do, it isn't good enough for them. My daughter's now 9, and I'm still afraid that they're going to come up one day, see her out by herself, pick her up, and say, 'You can't have her anymore.'" Finally, I want to give you a brief introduction to Gary Boatwright, whose story illustrates how these new automated decision-making systems can create a kind of empathy override. So the system I explore in Los Angeles in the book is called the Coordinated Entry System, and it responds to the county's unbelievably tragic housing crisis. So at the time of the book's writing, there were roughly 58,000 unhoused people in Los Angeles County. I live in a small city in upstate New York of 50,000 people. So my entire city is homeless in Los Angeles. And as of the 2020 Greater LA homeless count, there's been a 15% increase in homelessness in the last 3 years. So the homeless count now stands at 66,436 people in Los Angeles County, and something like 75% of them are completely unsheltered, meaning they're living in sidewalk encampments or in cars. So coordinated entry works by assigning each unhoused person a score on a spectrum of vulnerability. And coordinated entry actually serves those at the top pretty well. Those folks who face the worst consequences of homelessness, like death, like emergency room visits, like mental health crisis, like community violence. The system also serves those who are least vulnerable pretty well. Those folks who are referred to sometimes as the crisis homeless, who need a small investment to recover from an eviction, a foreclosure, a job loss, or domestic violence to get back on their feet. So unhoused people's vulnerability is established through a very extensive and what the people who take the survey see as a very intrusive survey called the VI-SPDAT. It's a very long acronym that stands for Vulnerability Index and Service Prioritization Decision Assistance Tool. And the VI-SPDAT asks questions like, do you ever do things that may be considered risky, like exchanging sex for drugs or money, running drugs for someone, having unprotected sex with someone you don't know, sharing needles, anything like that? Or another question on the survey is, have you threatened to or tried to harm yourself or anyone else in the past year? And some folks like Monique Talley, who I interviewed for the book, call coordinated entry a gift from God because it succeeds in getting a small number of people into appropriate housing. At the time of the book's publication, coordinated entry had matched nearly 10,000 people with some kind of housing resource. But then there are the 20,000 people that the system has surveyed and classified and turned into a digital profile, but who will never receive any resources. And these are people like Gary Boatwright, who is strong enough to survive, but not able to get back on his feet by himself. So he's classified by the algorithm as not vulnerable enough to merit immediate assistance, but not stable enough to be served by the time-limited resources of rapid rehousing. So Gary has cycled between bouts of homelessness and prison for about 15 years. From Gary's point of view, the problem is not comparative vulnerability. It's not comparing one unhoused person in his community to another. It's simple math. There's not enough housing in Los Angeles for the county's 66,000 unhoused people. So Gary told me, people like me who are somewhat higher functioning, we're not getting housing. It's another way of kicking the can down the road. In order to house the homeless, you have to have the available units. Show me the units. Otherwise, you're just lying. So Gary was arrested just before the book came out, and he was released in 2017 into a halfway house. The last time I saw him over lunch at the Nickel Cafe in downtown Los Angeles, he was hoping that his parole officer would let him move out of the county so he'd have more housing options. He knew that his time in the halfway house was limited and that he'd have to start all over again if he became homeless again. He'd have to get a new tent, collect his possessions, the paperwork he had left behind. He'd have to rebuild his social network to increase his safety. And if he chooses to take the VI-SPDAT survey again, he'll actually score lower because the model counts prison and halfway houses as housing. So he'll stay trapped, too vigorous for intervention and too marginal to make a go of it without support. I'm a criminal, Gary told me, just for existing on the face of the earth. So my greatest fear about these systems is that they act as a kind of empathy override. And because they allow us a sort of steam valve for our longing to respond to humanitarian and human rights crises, these tools radically limit our political vision, and they really absolve us of the responsibility to care for one another. And this is something in the book I call the trouble with triage, approaches that assume that there aren't enough resources for everyone, and then provide a sort of ethical cover for what actually amounts to creating hyper austerity and automated rationing. One of the things I always say about these systems is that triage, the idea that there are not enough resources and that we have to make hard decisions about who deserves to get their human rights met, that's always a political decision. So I just want to say a couple of words before I pass it on to Sasha about what I've been thinking about in these times of pandemic and political hope and possibility, and also struggle and disappointment. So there have been a number of really important changes in the digital administration of public assistance or social insurance in the last year. Some of them have been really promising, and some of them have been deeply troubling. So in this political moment, where so many people are deeply and visibly suffering, we have removed many of the barriers that we've been told are impossible to remove before. So if you look at Australia, there's been a 20-year campaign to try to raise the social insurance rate. There's been a long campaign to ban mutual obligations, but pretty much immediately after the pandemic, both the rate got raised and mutual obligations were at least temporarily suspended. Conditionality and cash transfers, like the Prospera system in Mexico, sort of ended overnight. And in the United States, extra money for unemployment and lowered or even waived eligibility requirements for other social programs were accomplished seemingly overnight. So these things that we were told in the past as welfare rights organizers and other people who care about economic justice, things we were told were impossible, sort of just happened. And I think that's an incredible that's a moment to take hope from, that the organizing that we've been doing for decades can be successful. But the pandemic has also made many more people much more vulnerable, and digital harms will continue and probably even get worse as the pandemic abates. So for example, one of the things I'm keeping my eye on is fraud prediction models and systems like Australia's robo-debt, which try to identify and collect alleged overpayments of public benefits. So once the pandemic passes, I suspect we'll see a serious uptick in the deployment of these systems, which use machine learning or artificial intelligence to predict cases of welfare, unemployment, or disability fraud, or go way, way back into payment records to find alleged overpayments of social insurance, and then automatically collect presumed debts. And I've written, about a year ago, I wrote about this for The Guardian US. And if history tells us anything, the extra pressure on our social insurance systems both provides political opportunity and also may deepen class divisions between the newly unemployed and the persistently or underemployed, class divisions that follow the gendered and racial divisions of labor. So the pandemic has made especially visible these life-altering politics of what work counts, how essential non-market care work is to the economy, and how ruthlessly we sacrifice those who do it. And I'm one of those people actually who's been doing a lot of non-market care work during the pandemic, supporting a partner with chronic PTSD. So I'm going to sort of pre-apologize that I may be out of the loop on the newer literature in this, but I do want to sort of mention two things that I'm hoping we'll do a bit more of moving forward. The first is to really very intentionally develop global and cross-national perspectives of how these systems work, particularly paying attention to those that are outside the United States and Europe. So some of this work's been done by the Digital Welfare State and Human Rights Project at NYU, and those of us in the North are increasingly paying attention to the important work that's coming out of the Global South. So this is improving, but particularly at a time when it's clear how interconnected our struggles to be well are. Global patterns, I think, really bear further attention. And also, I think one of the things that's still missing in this space and in this work are the voices of those who are most directly impacted by these systems, with the sort of marked and obvious exceptions of some of the folks on this panel. So I just wanted to mention quickly a new project that I've gotten involved in, and then hand over to Sasha. But I'm really proud of this work. My colleague Andrea Quijada and I have just begun a project gathering oral histories of the digital welfare state. So we're really excited to explore the unique stories of people who are most directly impacted by these systems, and also to sort of uncover and examine these kinds of global patterns that I was talking about. So we're working in Aotearoa, New Zealand, Australia, Colombia, Indonesia, Kenya, Mexico, the Philippines, Uganda, the US, and other places. And the questions that have driven the project are really, what's it like on the ground to live through this massively consequential but largely invisible revolution in the welfare state? Across countries and regions, what's the same, what's different? How can we identify and share strategies for resistance and community care in these incredibly difficult times? So we're lucky to be doing this work with Voice of Witness, which is a nonprofit that advances human rights by amplifying the voices of people impacted by and fighting against injustice. And their work is really driven by the transformative power of the story. And so what I want to close with is just to share a moment from one of the stories, one of the oral histories we've collected so far. It's from Hayden Patterson of South Australia, who's a long-term welfare and disability rights activist, and whose long experience with social assistance makes it possible for him to really see and articulate these incredible political economic changes at the same time that he sees changes happening in his own life and the lives of the people he loves. So I just want to share a little bit of his language, and with that I'll close. So he says, compared to when I was in my teens, the relationship with the job seeker's office is more adversarial. 25 years ago, employment services was quite a relaxed environment, whereas now it's not uncommon to see someone absolutely losing their shit in one of these offices or being crowded out by security. Today, most social services in Australia have been outsourced. The call centers and other aspects are now run by Serco, the same people who run security in our prisons. So it's not just privatization. It's not just a private company. They're security companies. It's not a two-way conversation anymore. You're told to do this, you're told to do that, sign this job plan. If you don't sign it now, we'll cut off your payment. Most people sign whatever's put in front of them then and there, even though the policy allows you 48 hours to think about it. People don't know what their rights are now. And even if they do know their rights, they're scared to use them. Before, it wasn't so important. You weren't being screwed over just because you were aware of your rights. So I'm going to wrap up, and we can sort of tackle these meaty questions together. And so I can hear what you have to say. But for now, I want to thank you for your time and for your attention. And I'm really eager to engage in the rest of this conversation. Thank you so much.
Thank you so much, Virginia. That was amazing. So much for us to think about. One thing that occurred to me as I was listening to you speak was that the VI expedite is something that actually the City of London has used recently in its creation of an enumeration report, which is sort of a snapshot of homelessness at a moment in time. So lots to talk about and unpack there. I see that we have our first question posed, so thank you, anonymous attendee, for being brave. And I hope that we'll get a number of other questions as we continue. For now, I would like to shift our attention to our second speaker of the evening. Sasha Costanza-Chalk is a scholar, activist, and media maker, and currently an associate professor of civic media at MIT. They are a faculty associate at the Berkman Klein Center for Internet and Society at Harvard University, a faculty affiliate with the MIT Open Documentary Lab and the MIT Center for Civic Media, and creator of the MIT Co-Design Studio. Their work focuses on social movements, transformative media organizing, and design justice. Sasha's first book, Out of the Shadows Into the Streets, Transmedia Organizing and the Immigrant Rights Movement, was published by MIT Press in 2014. And second, Design Justice, Community-Led Practices to Build the Worlds We Need, by MIT Press, just last year in 2020. They are a board member of Allied Media Projects. Allied Media Projects convenes the annual Allied Media Conference and cultivates media strategies for a more just, creative, and collaborative world. Thank you, Sasha, for joining us.
Thank you so much, Alyssa, and thank you, Allison, for the invitation, and Virginia for that phenomenal presentation. I'm really thinking about a lot of what you just talked about. I'm going to share my screen. I do have some slides, so let me get that going. And can you see my screen now? Does that look good? So I was thinking about what to talk about tonight, and given the topic, I was initially going to share key findings from a recent report that I co-authored with Diana Nocera, Burhan Tai, Mika Sifri, and Matt Stempek for Civic Hall, which is called Pathways Through the Portal, a field scan of emerging technologies in the public interest. And that is a field scan based on interviews with 24 practitioners who are applying AI and machine learning and VR and AR, virtual reality and augmented reality, and other emerging technologies for public interest purposes. And you can read that report over at mtechpathways.org. And the link is at the top of the slide. Maybe someone could put it in the chat. It's mtechpathways.org. But instead, as COVID-19 rates soar again and hospitals are nearly overwhelmed, I decided that instead I'm going to spend most of my time tonight talking about algorithmic necropolitics, race, disability, and triage decision-making. And this is a talk that extends a Twitter thread that I originally posted on April 13th of 2020 after a friend of mine who works at Mass General Hospital messaged me about an urgent organizing campaign about crisis care standards in the state of Massachusetts. At the time, I wrote, "The algorithm that will decide who gets access to life-saving care in the Commonwealth of Massachusetts was laid out on April 7th in this document, Crisis Standards of Care Planning Guidance for the COVID-19 Pandemic." At first, the document sounds good because the authors claim that, quote, "the Commonwealth's approach to crisis standards of care is that such tragically difficult decisions must be based on criteria that ensure that every patient has equitable access to any care from which they might benefit." And it goes on, "These criteria must be clear, transparent, objective, and must be based on biological factors related only to the likelihood and magnitude of benefit from the medical resources." And then it continues, "Factors that have no bearing on the likelihood or magnitude of benefit, including but not limited to race, disability, gender, sexual orientation, gender identity, ethnicity, ability to pay, socioeconomic status, perceived social worth, perceived quality of life, immigration status, incarceration status, homelessness, or past or future use of resources are," wait for it, "irrelevant and not to be considered by providers making allocation decisions." So why is this a problem? Well, we've already begun talking about this. Both Alyssa and Virginia, have talked about this in the introduction and in the first talk. And I'll get into some of the details in a moment. But the short version is that if you think health outcomes are based only on biological factors, then you're ignoring the overwhelming, long, and now pretty established paradigm shift known in public health as the social determinants of health. So according to the World Health Organization, social determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. Social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between countries. So to put it another way, the authors of the Crisis Standards of Care in Massachusetts are basically saying, well, we don't see race, class, or disability. And that's despite the widely reported, even then, and increasingly understood reality that Black and brown folks in Massachusetts, as elsewhere, were at much higher risk from COVID-19. So now, through the hard work of organizations like Data for Black Lives and many others who've pushed for race disaggregated, COVID data, we have a lot more information about the disparate, impacts and death rates. But even at the time, the Boston COVID-19 report published on April 2nd had showed that more than 40% of the city residents infected with the disease are Black, although Black people are 25% of Boston's population. What does this have to do with algorithms, you might ask? Well, an algorithm is a set of rules to be followed in calculations or other problem-solving operations. And here's how the proposed crisis standards of care algorithm works. From page 14 of that document, the triage steps for ICU admission and ventilation are: 1, calculate each patient's priority score based on a multi-principal allocation framework; 2, assign each patient to a color-coded priority group; and 3, determine on a frequent basis how many priority groups will receive access to critical care. And as they say, this allocation framework is based on 2 considerations. First, saving the most lives, and second, saving the most life years. This means that patients who are more likely to survive with intensive care are prioritized over patients who are less likely to survive with intensive care. And patients who do not have serious comorbid illness are given priority over those who have illnesses that limit their life expectancy. And the way the points are assigned is through what's called the SOFA score, or the Sequential Organ Failure Assessment, which is a mortality prediction score based on measurements of 6 organ systems. And the SOFA score category is worth 1 to 4 points, and the presence of comorbid conditions, it's 2 points for major life-limiting comorbidities, 4 points for severely life-limiting comorbidities. They add those points together, and that produces a total priority score ranging from 1 to 8. The lower scores indicate a higher likelihood of benefit from critical care, and the priority is given to those with lower scores. So once you've been given your score, your total priority score from 1 to 8, which is going to be higher for each condition you might have that reduces your chance for long-term survival, you get a color-coded priority. Step 2, use the priority score from the multi-principal scoring system to assign the priority category. And that's the part where we have a proposed algorithm, a set of rules to be followed in calculations or other problem-solving operations that was meant to be used for life-critical triage decision-making. Or at least that's the way that it was framed. So what's necropolitics, and what does this have to do with race and disability and COVID-19 crisis priority scores? Well, necropolitics is a term developed by Cameroonian philosopher and political theorist Achille Mbembe to describe the various kinds of social and political power that dictate how and whether people live or die, and under what conditions their bodies will continue to exist. And now I'd like to note that R. Joshua Scannell wrote about algorithmic necropolitics in chapter 5 of Ruha Benjamin's excellent edited volume, Captivating Technology, published in June 2019. And more recently, Rashida Richardson published an article called Government Data Practices as Necropolitics and Racial Arithmetic in October 2020. And among other examples, in that recent article, she also analyzes the Massachusetts Crisis Standards of Care. But so the proposed Crisis Standards of Care, I wrote at the time, is a necropolitical document because it lays out the algorithm that will allocate scarce resources to some bodies and deny them to others. It's about race and disability because its point system is implicitly racist and explicitly ableist. It's implicitly racist because it pretends to be colorblind, despite everything we know about how social determinants of health, especially race, structure risk for conditions that are considered comorbidities for COVID-19, like diabetes, chronic lung disease, and cardiac disease. It's explicitly ableist because many impairments will give patients a higher SOFA point score and a higher point score on prognosis for long-term survival. And that means that they have a reduced likelihood to be assigned to a higher priority group. And here I'd like to also note that Harold Schmidt, Dorothy Roberts, and Nwamaka Enenga published an in-depth analysis of New Jersey's crisis standards of care, which are basically identical to the Massachusetts proposed standards, titled Rationing Racism and Justice, Advancing the Debate Around Colorblind COVID-19 Ventilator Allocation. And it was just published in January 2021, on January 6th. So, in response to this harmful algorithm, masked as equitable triage, over 400 doctors, nurses, and other medical professionals in Massachusetts launched an open letter to the Crisis Standards of Care Advisory Committee. They pointed out that health conditions that directly or indirectly factor into the SOFA scoring system are disproportionately high among Boston's communities of color. So, for example, the diabetes rates are highest in Mattapan at 17%, Roxbury at 14%, and Dorchester at 12%. Dorchester, Mattapan, Roxbury, and Hyde Park have the highest percentage of both diabetes-related and heart disease-related hospitalizations among all Boston neighborhoods. And in addition, due to a well-documented presence of housing and environmental triggers, such as mold hazards and violations by landlords, poor indoor air quality, asthma-related illnesses are disproportionately high in Dorchester, Mattapan, and Roxbury. And so these are Black and brown neighborhoods primarily, and these healthcare professionals pointed out that Black, Latinx, and Asian populations are therefore at heightened risk of contracting COVID-19 and exposing their families, given overrepresentation as essential frontline workers. And they also pointed out that another group of people at the highest risk of acquiring COVID-19 is correctionally involved and incarcerated individuals who live in crowded conditions and bear a higher burden of comorbid conditions compared to the general population. And a year later, we really have seen that bear out in terms of the extremely high infection and death rates among incarcerated and detained people inside jails, prisons, and immigration detention facilities. So since mass incarceration is driven by racial and economic injustice, crisis standards of care, the authors wrote, need to take into consideration that those individuals put at risk for COVID-19 because of their identities and socioeconomic status will also be the ones who will be further penalized by the scoring system due to comorbid conditions acquired during incarceration. And finally, the signatories to the letter called out that the committee that created the crisis standards of care had little to no representation from the communities most impacted by COVID-19 and had no community oversight. Only 2 of the 16 authors were people of color. This statement also drew from the open letter from the Disability Justice Coalition, nobodyisdisposable.org. And if you could put a link to that in the chat, that would be great too. Noting that, quote, denying or withdrawing care based on protected characteristics violates many laws, including the Americans with Disabilities Act, Section 504, the Affordable Care Act, state and local civil rights laws, and the US Constitution. And the open letter ended with a set of demands. And the first demand was that, quote, just and ethical crisis standards that take into account political and social determinants of health to assure truly equitable allocation of resources. That was the first demand. And so I wanted to spend most of my time tonight on this example because I think it so clearly illustrates the core problem with algorithmic resource provisioning, or if you will, the problem with using, quote, big data, automation, and artificial intelligence to allocate resources, even if, or especially if, the intent is for social benefit. Most decision support systems are currently designed to ignore, rather than take into account, political and social determinants of everything: health, social determinants of wealth, social determinants of access to goods and services, social determinants of opportunities, of education, of employment, social determinants of liberty and autonomy. And so why do we continue to design systems like this? As someone who's both critical of, but also interested in and involved in the design of new technologies, I've spent a lot of time thinking about this problem. And in March of 2020, I published this book called Design Justice, Community-Led Practices to Build the Worlds We Need. And the book is freely available, open access for download from the MIT Press at design-justice.pubpub.org. And in the introduction, framework for analysis of how design of images, interfaces, objects, the built environment, socio-technical systems influences the distribution of benefits and burdens between various groups of people. How does design influence the distribution of benefits and burdens between various groups of people? And additionally, design justice focuses very explicitly on how design reproduces or challenges what Patricia Hill Collins, towering Black feminist thinker, calls the Matrix of Domination, which is the intersection of white supremacy, heteropatriarchy, capitalism, ableism, settler colonialism, and other forms of structural inequality. So in the book, I offer an extensive reflection on questions about the relationship between design, power inequality, and liberation. It's organized into chapters about values, thinking about what are the values that we encode and reproduce in the objects and systems that we design. Accountability, so who gets to do design, and how do we move towards community control of design processes? Narratives, or this crucial question that Virginia Eubanks raised of what are the stories that we're telling about how things are designed? Whose stories get told? And how are we scoping design challenges and framing design problems? Are we framing it in terms of scarcity? And as Virginia talked about, in terms of triage or the assumption of scarcity, or otherwise? Sites. So where do we do design? How do we make design sites accessible to those who will be most impacted by design processes, regardless of the domain? And pedagogies, or how do we teach and learn about design justice? Of course, design justice is not a term that I created. Instead, it emerged from a growing community of practitioners who are focused on more equitable distribution of design's benefits and burdens, meaningful participation in design decisions, and recognition of community-based, indigenous, and diasporic design traditions, knowledge, and practices. And it's a community made up of design practitioners who participate in and work with social movements and community-based organizations across the United States and around the world. And many are affiliated with the Design Justice Network. The Design Justice Network was born at the Allied Media Conference in the summer of 2016, when a group of 30 designers, artists, technologists, and community organizers took part in a workshop called Generating Shared Principles for Design Justice. And the goal of that workshop was to really get us beyond frames of, quote, social impact design or design for good, to challenge designers to think about how good intentions are not necessarily enough to ensure that design will become a tool for liberation. And we wanted to develop principles that might help practitioners avoid what is often an unwitting reproduction of existing inequalities in designed systems. And the network has been growing ever since through the efforts of many, many people. Here I just want to shout out the steering committee, which is Una Lee, Wes Taylor, Denise Shante Brown, and the network coordinator, Victoria Barnett. But there are so many people involved in this work now. The network is organized with more than 1,200 signatories to our principles. There are 400 members, and there are local nodes and working groups getting organized in places around the US, in Canada, and around the world. You can learn more about the Design Justice Network, and you can read or sign on to our principles or become a member over at designjustice.org. And so I just want to close my time now by sharing the Design Justice Network principles. Principle 1, there are 10 of them. Principle 1, we use design to sustain, heal, and empower our communities, as well as to seek liberation from exploitative and oppressive systems. 2, we center the voices of those who are directly impacted by the outcomes of a design process. 3, we prioritize design's impact on the community over the intentions of the designer, because we've seen many examples now of where good intentions lead. 4, we view change as emergent from an accountable, accessible, and collaborative process, not just a point at the end of the process. 5, we see the role of the designer as a facilitator rather than an expert. Because 6, we believe that everyone's an expert based on their own lived experience, and we all have unique and brilliant contributions to bring to a design process. So what would it look like if these systems of resource allocation really took seriously people's lived experience, as Virginia is documenting with her collaborators. 7, we share design knowledge and tools with our communities, rather than constantly trying to serve as expert gatekeepers. 8, we work towards sustainable, community-led, and controlled outcomes. 9, we work towards non-exploitative solutions that reconnect us to the earth and to each other. And finally, 10, before seeking new design solutions, we look for what's already working at the community level. We honor and uplift traditional, indigenous, and local knowledge and practices. And you can become a signatory to those at designjustice.org/principles. And I'll leave it there because I'm excited for the rest of the talk and the Q&A after that. Thank you.
Thank you so much, Sasha. That was fantastic. I want to go to the website right now, but I'll wait until after 9 o'clock. Thank you so much. We'll move on now to our final speaker of the night, Joanna Redden. She's a new colleague of mine here at FIMS, which I'm very excited about. She's also the co-founder of the Data Justice Lab and an assistant professor here at the Faculty of Information and Media Studies at Western. Her research focuses on algorithmic governance, particularly how government bodies are making use of changing data systems and the social justice implications of these changes. This work has involved mapping and assessing government uses of data systems, as well as documenting data harms and learning from those trying to redress these harms in policy, community, and activist contexts. Joanna's work has been published in journals such as the Canadian Journal of Communication, Policy Studies, Information, Communication and Society, and Scientific American. She has previously held fellowships at the Infoscape Center for the Study of Social Media at Ryerson University and the Goldsmith Leverhulme Media Research Center. So I'll turn it over to Joanna now. Thank you.
Thank you, Alyssa. Thank you to my colleagues here at FIMS and at Western for hosting this event. Thank you to Sasha and Virginia, who their work has inspired me, continues to inspire me, so I'm delighted to be part of this panel. I am going to share my screen now with you. And I wanted to spend today talking about some findings, some research in progress. But before I begin, I wanted to tell the story about the project I'm going to be talking about tonight. So I work with my colleagues at the Data Justice Lab. We work collectively and collaboratively. We work on a number of projects. And the project I'm going to be talking about today is very much informed by some of this work. So we set out a couple of years ago to map and analyze where and how local authorities in the United Kingdom were making use of data systems, particularly predictive systems. This led to a follow-on project, which we're working on now together, where we're looking at, and investigating what opportunities there are to enhance civic participation with datafied governance. These projects and many discussions with colleagues, peers, sources of inspiration in other countries have led to the project I want to talk about today. This is this last project listed here, Automating Public Services, Investigating Cancelled Systems. This project has involved researching paused or cancelled government automated systems in different countries. And it grew out of a recognition that government agencies in different countries were making the decision to pause or cancel their use of automated systems. And the idea behind this is that there's a lot to be learned from researching the factors and the rationales that are leading government agencies to make the decision to pause or cancel their use of automated systems, and that doing so would provide a means to get beyond the myths of technology and to start to have some very real discussions about the limits of technology. Further, sharing this kind of information is useful for others who are trying to automate or thinking about doing so. It's really difficult to get information for the most part from the beginning about where and how these systems are in operation, let alone who's pausing or canceling the use of these systems and why. The project is also built on a recognition that there are competing values, politics, and visions that influence decisions around whether or not to implement automated systems. And as Virginia Eubanks has said in some of her early work, we should be attending to, and there is important work to be done, attending to these technologies as sites of struggle and interrogating what's going on there. So this project was a team project like the others. This one is a project that has been funded by the Carnegie UK Trust. It's been going on for about a year. The researchers and the people that I've been working on in this project in partnership are Jessica Brand, Ina Sander, and Harry Warren from the Data Justice Lab. And from the Carnegie UK Trust, I've been working with Anna Grant and Douglas White. This is a work in progress, as I've mentioned, but when I was thinking about the topic of tonight, care and cruelty, in an age of big data, and particularly in relation to welfare, I found these concepts, the care and cruelty as lenses, provided a really rich means to think through some of the things that I was finding in this research. And tonight I'm going to talk about what our research says, what our empirical research says about what care and cruelty looks like in datafied societies. So I'll point to our methods here. So we began with a scoping exercise. We were limited somewhat by language, being English, German, and French speakers. And so we identified that we were going to look at where systems are being cancelled in Australia, Canada, across Europe, New Zealand, and in the United States. We consulted with experts, colleagues, peers in different countries to get a sense from people about what was happening in their communities and in their countries. We looked at media reports, we looked at documents, government and organization sites, and in the end, we produced a scoping document that we're just finalizing now. This led us to narrow down our investigation into case studies. We've narrowed it down to 15 case studies. And what we wanted to do with our case studies is we wanted to look at areas that were similar so that we could have a means of comparison. And in the process of narrowing down, when we kind of moved from our larger scoping document, we identified that we had comparative case studies across a range of countries in the areas of fraud detection, child welfare, and justice. We did interviews with people working on the ground in connection to our case studies, 23 interviews with public servants, lawyers, activists, and researchers. And then we did document analysis. So we looked at legal documents, we looked at government reviews and audits, we looked at contracts, we looked at media coverage and reports from research centers, et cetera. In terms of totals, we found a total number of canceled systems at 58. So in some cases, these are systems that are being piloted or trialed, and then there's a decision not to proceed with them. In other cases, the systems have been implemented, and after the fact, there's a decision to stop or cancel the use of these systems. These are the areas of service where the systems have been canceled. So as indicated by this table, you can see that most of the systems that have been canceled are in the areas of justice, so policing and the law. The second most common area would be welfare and benefits, and these are primarily fraud detection systems. We've seen systems canceled in the area of child welfare, and then education, immigration, finance, and to a lesser extent, border control, smart city, and health. What we suggest is that this research indicates that there's government agencies are seeking to be more efficient. This is the argument often for these systems, and to cut costs and to better use the limited resources they have in these areas. And it's important to consider who is most affected and stands to be most negatively affected when systems are introduced in these areas. And I think the politics here is important. So we have to recognize that there's a neoliberal politics at work here, and a system of governance that's based on fundamental social sorting or embedding of assumptions of people's value in the way that decisions are made. There are very good intentions, of course, to do more with less, but there are also decisions that are made about in what kinds of contexts is it okay to experiment with certain kinds of systems and make use of them. And here we have to, I think, really interrogate the value systems that are being put in place and the way some people are being deemed more worthy than others, and the way in which some people are being deemed more risky than others, and who is perceived to be a risk and a threat. And this is, as argued by Oscar Gandy, in these types of systems, these automated social sorting systems, to quote him, the poor, especially poor people of color, are increasingly being treated as broken material or damaged goods. And what we'll see in a moment here is, and what I want to draw attention to is, if we think about cruelty, we can think about the way that guilt is being suggested. So here, drawing on the work of Kimberly Crenshaw and Anna Lauren Hoffman, they raise the importance of the need to attend to the way that the kinds of systems that are being introduced have an impact of producing systems of advantage for some and producing systems of disadvantage for others. And if we look at I'll focus here on some of the fraud detection systems that we were looking at that Virginia referenced at the beginning. So we identified automated fraud detection systems that were canceled. We can look at the example in the Netherlands with system risk indication. We can look at the cancellation of uses of risk-based verification in the United Kingdom by particular local authorities. We can look at the case of online compliance intervention and the robo-debt scandal in Australia. Virginia mentioned an example in the United States, but there's also automated public assistance eligibility, automated food assistance eligibility, the Michigan Integrated Data Automated System Fraud Assessment. And here I think we need to be alert to the way that the kinds of systems that are being introduced, the way that they designate whole groups of people as being already guilty, right? There's a presumption of guilt. And this is something that Philip Alston recognized and wrote about in his report on the UK context. He said the presumption of innocence is turned on its head when everyone applying for a benefit is screened for potential wrongdoing in a system of total surveillance. And in the working of absence of transparency about the existence and workings of automated systems, the rights to contest an adverse decision and to seek a meaningful remedy are illusory. And here I think it's useful to think about who is not being targeted for automated detection in terms of fraud, right? So we're not talking about automated detection of, en masse of white-collar crime. We're not talking about tax evasion in the same sort of way with this presumption of guilt. And we also need to think about cruelty in terms of transparency and the access to information people have about the risk scores that are being attributed to them, or the kinds of decisions that are being made about whether or not they were overpaid their benefits, whether or not they're likely to commit fraud, right? And I think the Australian example here is a really good one, because one of the things that's come out of the robo-debt scandal in Australia and the introduction of an automated system to identify who had potentially been overpaid their benefits. One, it was really, really difficult and time-consuming for people to get access to information about their files, right? Some people reported spending hours on the phone sometimes trying to get someone to talk to them. These are people sometimes who are living in very precarious situations or who have, a lot of care demands, etc. So there's a time pressure that are put on people to sort out and to prove that they are not guilty, right? The other thing that comes out of some of these case studies is that we know that people are going to be falsely flagged. We know that there are going to be errors. So in a situation like this, there's a cruelty embedded when you know that you're going to be wrong sometimes. And in the case of some of the systems that we've looked at, there's a lot of error. These systems are wrong sometimes, a lot of the times. There's a cruelty in not making it easier for people to challenge or contest when they've been falsely flagged, right? And if we stay on this notion of cruelty, there's also a cruelty in relation to time. So the time and the resources that it takes to have that negative, that wrongful determination about you addressed, right? So there have been legal challenges of some of these systems. So in the Netherlands, the court ruled that the system risk indication system violates higher law. It's a violation of human rights. In Australia, the Robodebt, the online compliance intervention system, has been ruled unlawful. There was a class action lawsuit which was settled for $1.2 billion. In the United States, there have been lawsuits about some of the automated fraud detection systems put in place there. But these systems, overturning these systems once they're in place takes a lot of time, takes legal challenges in the cases as I've indicated, and it demands a lot of resources. And in the meantime, we have massive destruction of lives, right? So we have bankruptcy, as the couple in the top left have talked about. We have stress, we have family breakdown, we have illness. And in some cases, the fight for restitution is still ongoing. Even after something has been deemed to not be working, there's still the battle over getting restitution for the error that was made, which caused such destruction in your life. And even if you do get, in some cases, if you do get some of that money back, it's not going to fix your bankruptcy. It's not going to fix the lawyers you had to hire to seek restitution. It's not going to fix, the breakup of your family. It's not going to fix getting kicked out of your housing situation, right? The other thing that we can talk about in terms of time is how long it takes sometimes for agencies to recognize that these systems aren't working so well. And there's a luxury here in time in terms of, things can move very slowly if you're not the one being negatively affected by these systems. So what are the factors that are leading to government agencies to pause or cancel the use of these systems? And here you can see that we've identified a range of interrelated factors that are occurring in the examples that we're looking at. And I think these examples really point to the ongoing struggles that are happening around the implementation of these systems. So critical media coverage was identified as a significant factor in more than half of the paused or canceled systems that we looked at. We found that in many cases, media coverage was responsible for identifying trials or implemented systems that were not widely known about until they were reported. And in this way, media coverage serves to render some of these systems visible, but also the impact of these systems visible. It was common for media coverage to reference civil society concerns being raised, so there's civil society mobilization and action and protest and organizing. And our research demonstrates the success that's happening as a result of legal challenges, and also the important role of oversight bodies. So we found examples of government review and audits, the importance of independent review. And I think for my final slide, what I wanted to conclude with was a discussion of what does care look like in datafied society. So what does our research tell us about care and how we can understand what care might mean in a datafied world, and particularly in relation to datafied governance. So I think that time again comes up. So we found examples, a few of government agencies really spending a lot of time to research whether or not they wanted to proceed with automated systems before implementing them, and doing investigation and review, but also seeking independent review. Ideally, although this doesn't happen as much as it should, it needs to be happening a lot more. There needs to be a lot more engaging with impacted communities and changing who's at the decision-making table. We found some examples of after critique, a government agency making more transparent the model that they were planning to use, and then inviting dissent, inviting review, and then listening to and responding to that review and deciding not to go ahead as a result of some of the concerns that were raised. We also heard about within government agencies a countering of a logic of prediction about internal debate among government workers about whether or not and to what extent the prediction of life outcomes is possible. And there's a lot of, I think, really important research coming out now about how possible it is to do such a thing, right? And then I think our research demonstrates the role of media coverage, critical media coverage, investigative reporting, reporters who are doing follow-up, who are documenting impact and making this information public. And then our research also shows the importance of community, of mobilization, of engagement, of community activists and organizers and research bodies digging in and trying to investigate what's happening in their localities and in and around them. There's indication of political interventions and legal challenge, as mentioned. And others arguing for the need to account for structural violence, so to account for the very imbalanced, unequal societies within which we live and the ways in which power dynamics get embedded in these kinds of systems, and the need for history of social context to be taken up in order to really understand what the impact of these systems might be, and calls for, and this is something that I think we might see more of, calls for no-go areas, right? When the risk is so great, are there areas that we as a society just should not go? And I'll conclude by just pointing to the fact that our future in this area is undetermined. And I think this is something this research really demonstrates. Struggles are going on in and around the implementation of these systems. There are people who have implemented, changed their mind. There are people who are doing very careful research and considering taking time to do things differently. Also, the struggles around these technologies are political. They're about the visions of people and the kinds of societies that we want to live in. And with that, I'll conclude, and I look forward to hearing what others have to say. Thank you to all the wonderful people around the world who contribute to this research.
Thank you so much, Joanna. I really appreciated in particular the last point that you were making there about sort of pushing back on this idea that the horse is out of the gate, and rather instead thinking about how these systems are continuously being challenged. And so we really have, I think, opportunities to make sort of important impacts in this space still as it continues to emerge and evolve. So it looks like we have a few questions, and we have time for a few questions, which is very exciting. I was just reviewing them. Please, if you have additional questions, feel free to post them in the Q&A. Looking through the questions here, it looks to me like we have a couple questions that are methods related, or sort of focusing on relational questions regarding relationships between researchers and participants, or researchers and academic institutions. And perhaps we can expand that also to include researchers and governmental bodies. So maybe I'll start there. And the first question is directed to Professor Eubanks. But perhaps we can open it more broadly as well if Sasha or Joanna also have responses. And the question is, how do we as academics or researchers amplify the voices of people impacted by injustice in a non-extractive way that recognizes the privilege of the researcher or researchers and the unevenness of relationships between researchers and researched?
Yeah, that's an amazing question, and really appreciate it. And I'm actually going to sort of like gesture towards Sasha, because I think in many ways their design justice framework, or the framework that came out of the work that you collected in your book, research design is design. And many of the principles are quite applicable across the domain of designing objects or designing processes for collecting, creating, and amplifying knowledge. So I'm going to refer back to Sasha's lovely slide and book of the 10 design justice principles for many of those, many ideas for how to do that. One thing that I do want to mention, though, and one of the things I say in Automating Inequality that I think is really important, is that I say, like, poverty is not an island, it's a borderland. And so this idea that, like, we academics are us and those people we research on are them is actually not always true. So, you know, as somebody who's been on public assistance myself, whose partner now is on disability, right? These are systems I interact with every day. And I actually think one of the things that really strikes me every time I do talks in public is there's always like 1 or 2 or 3 people who come up to me after the talk and are like, I'm on food stamps. And I'm like, yeah, you and a third of the rest of the room, right? Like it's really about this way that we obscure our own stories and our own experience when we talk about things like public assistance use in the United States, especially, but this is true, I think, in other places as well. So I think that these concerns and questions about navigating our privilege in research are incredibly important. And then sometimes I think this anxiety about privilege like keeps us from recognizing the fullness of our own stories and our own sort of implications in these systems. So I think it's good to sort of be balanced about that. But I want to ask Sasha if you think that some of your design justice principles or some of the principles you collected are particularly applicable for academic research and for answering this question.
Thank you. I mean, I love the way that you answered the question. So I don't know what more to say about the principles, but maybe I would just respond with a very specific, you know, practical recommendation because the question from anonymous attendee is speaking as an academic researcher. You know, something I've learned in the class that I've taught for many years around trying to do collaborative design, community-led design work. And later, you know, design justice as a framework, you know, was kind of emerging. But very specifically, you know, I work with my students and make sure that they think about, you know, for example, if there's money, if there's a grant involved, you know, there should be a line item in your grant for a community-based organization as your partner, because it's going to take time and energy and resources for people to be able to meaningfully participate in your study design, or if it's another type of class, you know, if you're doing product design, you know, that as well. All those things take time and energy and resources. And although I totally agree that, you know, academics, you know, we're often in those borderlands, you know, of poverty, but you know, there are certain resources that we have access to, and we can leverage them in ways that some of our community partners might not always have access to. So maybe that's grant money or resources, or maybe it's resources within your institution that are available to support people to come as speakers or to, you know, participate in the work meaningfully. Now, that doesn't solve everything, right? It's not a checklist. It's not a magic bullet. Like, just because you pay someone to be involved in a project doesn't mean that it still might turn into an extractive project, right? So you also have to think about, okay, well, who's getting resources to participate? Who's getting, who controls the narrative? Who's getting visibility, you know, from this? When you present your research findings, are you inviting, you know, community partners to come with you and co-present? At least sometimes, if they're interested in doing so. They may not be, but maybe they are. So there's a bunch of very practical strategies that I think we can use to redistribute some of the resources that we might have access to inside academic institutions.
Thank you. So you sort of anticipated a little bit sort of the second question that I was going to draw your attention to. And this looks at the relationships between researchers and academic institutions, and particularly perhaps a kind of inertia or constraint from an institutional perspective to employ these design justice principles and pedagogies that you described. So the question by anonymous attendee is, what kinds of infrastructural changes need to happen within the academy so that design justice pedagogies can be more robustly deployed in our research to properly respond to the urgency of need in our communities for resources and support? And how can we foster coalitions across institutions to set different academic standards for this across the board?
Well, maybe I'll take the first crack at this one. So many infrastructural changes inside the academy. I think that, so many institutions right now are facing potentially moments of reckoning, in particular in the US context around racial justice. So one thing that social movement activity makes possible is institutional shifts. So the Me Too movement made it possible to force infrastructural changes inside large institutions like the academy or like some private companies, to rethink how they were going to handle, sexual assault, and Title IX violations and so on and so forth inside the institutions. Sometimes that's lip service and sometimes real shifts happen. Black Lives Matter as a movement that has, that is transnational, has also forced, first every institution to pay lip service. And then the question is, what structural shifts can happen, whether that looks like hiring practices, whether that looks like reporting practices. There's just lists upon lists of demands that people inside every institution have developed and pushed, and social movements make some progress possible, in those areas. So I don't think there's one answer. It kind of depends on your institution too. But I think what we need is stronger social movements outside of the academy, to me, honestly, are what is going to make it most possible to shift policies at the level of academic institutions. Although also that's not a hard, there's a porous border there. Many people inside the academy participate in social movements, very much so. But I don't think the change only comes, kind of in an isolated way within one sector. I think it comes through broader moments of political possibility. And I wonder what others think about this question too.
Joanna, you want to take a stab?
You go first, Virginia. That was such a good answer. I'm still thinking about some of the things.
I think like Sasha that they're, everything from the way tenure is awarded to the way we budget, and the way we allow folks to spend money, like what counts as an expenditure or what counts as like you can pay people for like super fancy conference food, but you can't like pay for childcare, right? Like everything, like from the bottom up and the top down, really, to me, needs to be shifted for universities to really become partners in economic, racial, gender justice. So I think there's an incredible space of possibility there. But as someone who is a part-time academic and has feet in other worlds, I see the role of that institution as being fairly limited, frankly, in really pushing forward social change. I don't think that's necessarily a bad thing. One of the things that I've learned writing more as a journalist over the last few years and less as a scholar has been how much I appreciate the slow accretion of knowledge that comes through institutions like universities, and how that does something quite different than the work that I'm able to do as a journalist, which is faster, but in some ways shallower. So, I mean, I think we might be focused on the university as an engine of change because of the context that we're in, but I just don't want us to see that as the only place where we make contributions as people who are also members of communities and members of families and members of movements, and like we have all these other parts of our humanness. And so we don't just have to see the university, our workplace, or our study place as the place to manifest our desire for change in the world. It's an important piece of it, but it's not the only piece.
Yeah, I mean, I think in addition to all the great things that have already been said, I think a key infrastructural change would be to make international collaboration easier, and not just with academic partners, but it's because just as I think Virginia said at the beginning of this talk, and I totally agree with this, like we're limited because of the ways in which there are these Western biases and all the way that we talk about data, and our inability to learn from what's happening in the South and other countries, and the way that people are challenging and building new ways to do things with data, new ways to challenge systems, new kinds of politics, right? And so and practices. So yeah, I think a really important infrastructural change would be to try to get facilitate more international collaboration, and make that easier to do. It's difficult.
Thank you for that. So we have a bunch of really great questions rolling in, and I'm going to go to one that was just upvoted, which was asked by Thomas Randall. And the question, well, first, he thanks you for your presentations, and he says, a question for Sasha Costanza-Chalk. Public Health has issued several statements, Ontario Public Health, has issued several statements alluding to a colorblind approach to COVID-19 data collection. Specifically, this has been done to avoid stigmatizing racialized people as health risks. My question is, how do we balance the consideration of racially specific vulnerabilities with the potential for these vulnerabilities to be weaponized against them?
Yeah, I mean, here I would really point everyone directly to that paper that I mentioned in the talk, and I added a link in the chat by Schmidt, Roberts, and Nyanya, called Rationing Racism and Justice, Advancing the Debate Around Colorblind COVID-19 Ventilator Allocation. It just came out a couple weeks ago, and it proposes 6 possible approaches to that question, and explores sort of ramifications of each.
Are there any other thoughts before we move on to the next question? Okay. Amy Chen asks, as many of you pointed out, there are lots of issues with automating social services when the goals are triaging resources and reducing costs by replacing social workers. What might a well-used algorithm for supporting social services look like, or should there not be any?
So one of the things I wanted to sort of raise with the panelists connects to Amy Chen's great question. And so I want to kind of raise it here for all of us maybe to think about a little bit together. So Sasha, I so appreciated you talking about the SOFA score, because I think one of the things that is so clear in this moment is that any kind of triage system, like any kind of budget, is a political document. And like participatory budgeting, participatory triage can actually be a limited and incomplete, but like an interesting avenue forward. So I'm really reminded of Sherry Fink's like sort of brief but really important mention of participatory triage towards the end of her great book, 5 Days at Memorial, which is about the triage decisions that got made during Hurricane Katrina in New Orleans in the United States. And it also connects to these bigger questions of like, how do we do more participatory scholarship? Because one of the things she found is that when you plan in advance and ask people like what they think about how we should make triage decisions, that they actually have really compelling ways of understanding human value that are different than these systems that we often see in expert logic. So, for example, in Sasha's example, the quality hours of life, not just like how many lives saved. That's one of the things that directly got asked around participatory triage, and the people in the sort of normal folks involved in those processes pushed back and was like, my grandmother's hours, just because there's fewer of them, are not worth less than like my hours as an 11-year-old who wants to grow up to be old, right? Our elders perform this incredibly crucial service to the community of being community memory and mentors. And like, those are really valuable hours. So there's this incredible pushback when we actually ask people to think about questions of value that really break this yoke of like this idea of efficiency as being simple or non-political. So I'd love to like ask everybody to sort of to tell me what they think of this idea of like, can we do participatory triage? Is this something that if we did in advance of a catastrophe like COVID, we would do a better job of making collective decisions about what we valued and how we distribute resources, especially in moments where resources are actually scarce, which I think is rarer than they say they are, but there are moments where resources are actually scarce.
I mean, I really think that participatory triage is interesting, but I mean, you've got me convinced, Virginia, with your like insistence that we shift away from a triage and a scarcity mentality and kind of flip the entire conversation on its head by saying, you know, we don't actually have scarcity. We have the ability to allocate the resources that we need for people to be okay, and we're not doing it. And so it's a political problem, not a math problem. And I think part of what, I don't know if worry is the right word, but part of what complicates the participatory triage approach is like, if you look at the, gosh, was it the paper I just referenced or was it Rashida's paper? Now I've got them mixed up, but one of them cites some like public opinion polls around like what people think about that triage algorithm. And it's like, yeah, white people in the suburbs thought it was great to do the number of total life years, and Black and brown people in the most hardest hit neighborhoods were like, no, that's really not a great idea. So I think depending on your position within the matrix of domination, you might have a very different, feeling about what an appropriate triage system looks like. And yes, there is some, I don't want to like foreclose the possibility of the development of empathetic and shared and mutual sort of, positions after like deliberative democracy research and stuff. Like, oh, if we actually have people from multiple positionalities go through a structured process of thinking about this problem together, we can arrive at, better outcomes. And so I do think that's true. So I like the idea of exploring it. I worry a little bit that at a larger scale, it just ends up turning into those with the most political power get to participate most and get to still shape those decisions. So that's why I really enjoy your invocation that we turn to thinking of to an abundance frame away from a scarcity frame. What do you think, Joanna?
Yeah, I think I'd be concerned. I mean, I like the idea of participatory decision making quite a lot, and I would worry about the delimiting of it being to a framework of efficiency or not taking into consideration budgetary considerations. So if you're already working with with this notion of scarcity, then you're going to have to say no. Whereas maybe if there was a budgetary decision or if there was a different kind of frame, then the other choices would be on offer. I think that in relation to efficiency, I guess I am struggling with efficiency quite a lot because it comes up so much, and it's such a frustrating a narrowing of the conversation that doesn't take into consideration, and I know that's not what you're saying, Virginia, you're talking about something different, but I'm just going back to the question a little bit here. And so I think that, some of the most exciting conversations that I've had when I talk with social workers or with others who are responding to the use of these systems are, well, what we need to do is we need to expand the conversation, which I think has already been said. We need to talk about not just this system. We need to talk about the wider political structures and how it is that we got here, that this is what we're being told that we can talk about, and we can't talk about these other things. We can't talk about, all of the other wider social, political, and economic structures that led to this situation of scarcity, right?
So I think that's one of the reasons that, Joanna, your work is so important, is that it undercuts this argument of efficiency, right? So that's what people said in Indiana, was like, this automated eligibility system would be more efficient, would save time, would save money. And it didn't, right? And it didn't so badly that at 3 years into a 10-year experiment, they canceled the contract. And then the contractor sued them and won initially, not just the $500 million they had already collected, but also like a $10 million penalty for breaking the contract, right? So this idea of these systems being efficient, like, I think as we study the kinds of systems that get challenged, that fall apart, that don't last for that we pull the plug on for whatever reason, I think it becomes easier to push back against that efficiency argument. So I so appreciate that work. I'm like Sasha, want to put in the chat, canceled systems with exclamation marks after it, because it's so important to dismantle that narrative that these systems are inevitable, they're coming, there's nothing you can do about it, right? Until there is something you can do about it, until, we organize and we shut them down and it works.
Well, and it was, I mean, not to belabor this point, but I just want to go back to that Indiana example, because it was that article, some of these threads started to come together, right? It was that article in the Atlantic where you wrote about Indiana, and you wrote about the huge cost and the ongoing legal battles and all of these things that demonstrate how these things how inefficient they are. And then these rumblings that we were hearing in the UK about local authorities saying, well, actually we're turning away from risk-based verification because it doesn't work so good, and actually it costs more. And the kind of the bubbling up of these stories of things not being so efficient as you just mentioned. I mean, that's kind of the thread.
And that's not the big picture, right? The big picture is we do it because it's not just, we don't do it because it's not just, but it is a useful argument. I'd say the one thing I'm concerned about around that is, by the time you experiment on people and then the system fails, honestly, the system has already worked. So like in Indiana, I'm thinking about Lindsay Kidwell, one of the people I spoke to for the book. She had been through the eligibility automation, had fought back, had gotten her benefits returned, had gone off them when she got married. In the meantime, between 2008 or 9, when this happened to her, in 2017, the last time I talked to her, she'd been divorced, and her economic situation had become seriously precarious again. And I said, oh, so have you applied for public benefits again? And she was like, oh, hell no. I will never do that again, because it was so dehumanizing and such a horrible experience that me and my kids will starve first. And so in a way, even if the systems fail, they work in the sense that they lower the rolls for people on public assistance in the United States. So that's my fear. The other fear, to respond to one of the other questions in the Q&A about workers, is by the time the systems fail, the workers have been retrained by the systems to see themselves as cops rather than caseworkers. And that was a real concern that frontline workers expressed to me, was they felt like, oh man, the new kids coming in don't actually know what the job is. They don't know that we're not data processors. They don't know that we're not cops. They don't know what it means to be a caseworker. And that was a real concern for frontline workers, particularly in Allegheny County, who felt like they were being trained by the algorithm rather than the other way around.
Okay, so our audience member Daryl Piber shares all of your feelings, I think, about efficiency as a design logic, a flawed design logic. And I think we've addressed much of the question, but he does ask for other sort of more useful design logics or goals and how they might be integrated into algorithmic design.
So I happen to have an answer to this question. So together with my colleagues and collaborator, Joanna Redden at the Coding Rights, which is a Brazilian feminist hacker and legal and public narrative organization, we created something called the Oracle for Transfeminist Technologies, which is kind of like a speculative design tarot for creating technologies from the future that are built around values other than efficiency or profitability. And here I'm going to share a link to the project. And so in the game, which we've used in many different contexts, one of the decks is the values deck. And if you load the site and scroll down, you can click on the purple values deck and you can get a preview of what some of those values look like. And so we ask people to imagine, based on the hand that they're dealt, to redesign technologies like AI around values like resilience or accountability or pleasure or horizontality or decoloniality or solidarity or multi-speciesism or non-binary or intersectionality or consent, and it goes on and on. And so we basically like drew out a set of values that we think sort of represent our sort of synthesis of transfeminist thought and practice, and turn them into this game that you can play, but you could also actually use in a real world design process to reimagine a particular project that you're working on if you were to center a different type of value.
That looks really interesting. I'm going to try out that tarot. So we have about 10 more minutes left, and we have a bunch of questions to get through. So I'm just going to kind of go down the list now. And anonymous attendee has asked, can we please step outside the academic circle? What can an individual in their own communities do, or on a personal level? Thoughts there?
It's speaking from the perspective of these systems in public assistance or in social insurance. So I come from a background in the welfare rights movement, and one of the things that was really powerful about the work that I did when I was the work that I was involved in is the work of sort of peer support within these systems. So I don't know if it's an upside of these systems, but like basically once you build an algorithm, you've built a system that can be predicted from the other side as well. And so there's a great value in sharing your experience with other people in order to identify patterns and identify ways of getting through these systems with your dignity and your ability to support yourself and your family intact. So we found those sort of mutual and peer support systems really important. Another thing that we struggled to do, but we found incredibly useful when it worked, was to reach out to the other folks directly on the other side of the desk. So frontline caseworkers and recipients of public benefits often see themselves as enemies of each other because the frontline workers are the face of a system that is often really dehumanizing and dangerous to people who seek support from them. But we found when we compared our experiences that often people on the other side of the desk were working off their own benefits or who had been on public assistance themselves, and our stories were actually quite a bit closer to each other than we thought they were. So those kinds of moments, like one of the historical moments I remind people of in automating inequality is the moment that we first started to see what I call the digital poorhouse, which was in like 1968. And part of the context of these tools coming online in the late 60s is that across the country, there were these widespread strikes of frontline caseworkers striking not for their own employment relationship, but for a better deal for their clients. So it was in this moment of strategic solidarity that these tools were born. And in part, I think that explains sort of the political problems that these tools were trying to address, which is us seeing our experience mirrored in each other. So I think that kind of work can be incredibly important.
Yeah, I think I agree. And I would just add, wearing another one of my hats as a senior research fellow at the Algorithmic Justice League, I would encourage people to connect with this new initiative that we're developing, which is called CRASH, the Community Reporting of Algorithmic System Harms. So we're going to crash the system together by doing exactly what you just described, which is like sharing stories about the way that different algorithmic systems have harmed us, and finding ways to connect people who are experiencing algorithmic harm to organizations that are best positioned to support them, to navigate that, to seek redress. So sometimes that looks like joining a class action suit. There's been a lot of class actions lately around different types of algorithmic systems. Sometimes it looks like, organizing to go to journalists or to the media. Sometimes it looks like organizing locally to pass municipal legislation. So right now, for example, we've seen many cities begin to organize and then pass bans on the use of facial recognition technology by police and law enforcement. And in some cases, those are broader bans or moratoria that extend to all government use of facial recognition technology. And in the case of a couple places like Portland, it extends to both public and private use of that technology. So people are getting organized and rolling back some of these systems. That's why I'm so excited by, Joanna, by the work that you've presented tonight. I can't wait to dive into it further. But there's a lot happening, and the bad news is these systems touch every area of life. But the good news is they touch every area of life. So on some level, everyone's impacted, and it means that you can find a local way to organize, whether it's passing a facial recognition ban or moratoria, or trying to keep these systems out of schools in your school district, or the list goes on and on. So it's connecting with others and getting organized.
And if I could just add on to those two comments, I think the one thing that's just legal aid. Like there just needs to be, legal aid has been cut so much in so many different countries, and it provides such an important and essential service for so many people. And I think that really comes through in what we're seeing in our research. So we need to support legal aid much more. And as Sasha and Virginia said, support local community organizations that are on the front line and work with them. Let's communities of care.
Great. So we only have a few more minutes left, so I think we're going to probably just stick with one final question, and then I'll invite each of you to share any final thoughts that you might have. And I think I'm going to take Josh Smicker's question because it relates to COVID vaccine rollout, and I think that's something that's been on all of our minds quite a lot lately. And he asks, given the perspectives that you've advanced in your talks, he's wondering if you had any thoughts about what specific ways or elements of design justice or avoiding automatic austerity or others of your guiding concepts might be applied to the rollout of COVID vaccinations in the US and Canada.
I don't know if there's an unpopular opinion, but I think that on the one hand, there has been a real mess in the US in the rollout. And the reason we have that mess is because up until very recently, we had just completely awful administration that was actively distributing disinformation, about COVID. And in that context, it's just very chaotic, the rollout. On the other hand, I think that in most places, at least in the US context, the good news is in terms of prioritization, for the most part, healthcare workers, are getting the vaccine first, followed by other types of first responders and people in a lot of direct contact. So at least the very first layer has been good. And then typically following that, phase 2 is, then it's usually people over 75, people in, long-term care facilities. So I think that in most places, a lot is being done right, according to design justice ideas. I think the challenge comes in that next step. And the reason we're having the challenge is the failure to produce the quantities, the failure to organize information about distribution as well as it could have been. So I'm not sure what else we can't do that much given the cards we've been dealt. I don't know what it looks like from the Canadian side.
I think one of the principles that we've talked about around maximizing autonomy is really crucial in one key area of vaccine rollout, which is really the failure to pay attention to folks who are in institutions not of their choosing. So whether those are incarcerated people or those are folks in different juvenile facilities or other places where folks' autonomy is already severely restricted, right? So there's so much media and sort of public dialogue about people making bad choices, but that have created the crisis in the United States. And I think in some ways that's a convenient narrative because there are many people who didn't have meaningful choices to express, right? Who didn't get it from going to a barbecue, but got it because they were forced to go to work because our unemployment system doesn't cover undocumented workers, right? Or who were exposed in prison or who were exposed in juvenile facilities, right? So for me, one of the key principles in the sort of vaccine triage that we're not maybe paying enough attention to is situations where people's autonomy is seriously compromised. So that's something I would like to see us raise.
Yeah, I don't know if I feel like I've got so much to research and learn about this vaccine role. How do you put it all together? Where do but I guess in the world of COVID, this is I guess an often repeated mantra, but I would hope that we come out of this with a reevaluation of what essential work is, and that we protect people accordingly and pay them accordingly. That's in the same way that we talk about tech is maybe when we start talking about tech and tech systems with the hope that we can reinvigorate some of these political discussions around homelessness or poverty, etc. Maybe ideally, we come out of COVID having a reinvigorated discussion about essential work and paying people accordingly and protecting them, which is not related to vaccines, but is connected.
Yeah, and I'd just like to lift up a really great series from Voice of Witness, who I mentioned earlier, called Unheard Voices of the Pandemic, which is a collection of very short oral histories from the folks you don't normally hear in the media with their experiences with COVID. I'll drop a link into the discussion box.
Yeah, and I just wanted to add one more piece to this conversation, which is, on a global level, we still have a long way to go for distribution, and we have the radical inequality in the projections between sort of 1/3 world, wealthiest countries, the timelines for, most people getting the vaccine, and most of the world, 2/3 world. And one of the big pushes that I think we should be involved in on that is the global campaign to open the patent. There are many firms that could produce the vaccine that have the capacity to do it, and they're being, blocked because it'll be less profitable for Moderna and the largest the medical multinationals. That is absurd and criminal. And so we need to support the campaign to open up the production to any organization that can demonstrate that it can produce at scale. And there's a campaign for just that.
So I'm cognizant of the fact that we are now about 5 minutes over time. And while I would love to continue this conversation endlessly and make sure all of our questions got answered, I do feel like out of respect and gratitude for our panelists that we should wrap it up. And I apologize to my dean who asked 2 questions that I've left unanswered. Sorry, Lisa. But I just want to say thank you so much, Virginia, Sasha, Joanna. This has been a wonderful session. You all have done such amazing work, and seeing how it all fits together and complements each other has been really eye-opening for me, and I think for our audience. So I just want to thank you so much for taking the time. I look forward to speaking with you tomorrow morning. And if anyone has any final thoughts, I'll invite you to share them now.
I'm just so grateful for the invitation and for the opportunity to talk with Sasha and Joanna. So I just want to end with my thanks to my co-panelists, to the organizers, and also to the amazing audience. There's still 80 people out there watching this. Bless your hearts. Thank you so much for being here with us tonight, or this morning, or this afternoon, depending on where you are.
Exactly the same. Thank you so much. This was really just a wonderful conversation, and I really appreciate the opportunity to be in dialogue. So appreciate you, and good night.
And so much thanks from me, and it's such a pleasure to be part of the conversation, to be able to talk to all of you. So thanks everyone. Yeah, it's been really, really rich and wonderful.
I just want to jump in and say thank you to our panelists and everybody who's still hanging in there, and to keep an eye out for our next event in the Big Data at the Margin series on digital policing and facial recognition technology. Thanks again to Joanna and Virginia and Sasha, and everybody stay safe out there. And Alyssa, of course, our wonderful moderator. And we'll see you at the end of February.